Hi everyone, welcome to another episode of the Lucas podcast. Right, today we're very honored to actually have two doctors in the house. Right, so we have Dr. Christine Wong, right, and we have Dr. Shin Jee Tang in our episode today. So of course, today we're actually going to be speaking about the career talk, about medicine, about the course itself, and a little bit about how's life being a HO and an MO. Housemanship, and also of course the medical officer. Right, so without wasting any more time, okay, let's introduce yourself. Dr. Christine Wong.
Hi, I'm Christine. I'm Mr. Lucas's student back about 10 years ago. I'm currently a medical officer working in Singapore, and anesthesia medical officer.
Dr. Shin Tang.
Hello, so my name is Shin Jee. I was Mr. Lucas's student about 8 years ago, and I'm now a first-year house officer.
Right, welcome, and thank you for being a part of the podcast today. Right, so yeah, let's get it started. Yeah, okay, right. Today we're gonna be speaking about specifically about medicine, the course itself. Right, how's life like studying it? Of course, then after that, working life as well. So let's hope that after today's session, right, those who are actually listening in can basically firm up the decision, right, on whether to actually take up the course or not. Or if those already have a firm decision to actually take up the medicine, they can still learn up a lot more from you guys about the application process as well as the day-to-day working life as a health officer and also the medical officer. Right, so let's just get it rolling. Yeah, so yeah, all of us knows medicine is not easy. It's not for everyone, right? So its course is actually long, it's demanding, it requires a lot of commitment and sacrifice from ourselves. So what happened is that what basically motivates you to actually apply for this particular course? Maybe Dr. Christine Wong, can you just start?
Yeah, okay. Basically, when I was in A levels, I haven't decided like what I wanted to do yet. I know that I want to do something science related. That's why I took up all the triple science courses in A levels. But what made me decide is that I did an attachment in Sandari Hospital for about a week plus, and kind of follow the doctor around and see how it worked in the hospital. And it was very exciting. I get to talk to quite a few people, and also walk around the whole day. Then I did another job which is related to accounting. It's more like a 9 to 5 office job, which I sat in the desk most of the day. And I kind of, in between those two, I kind of decided that, yeah, a desk job is not suitable for me. So I decided that foreign medicine is quite a good idea, and I just went for it.
All right, great. What about Shinji?
Yeah, so very similar to Christine. I always knew that I wanted to do science, so it was kind of like a tie between engineering versus medicine until I did at 2 days attachment in Sime Darby Hospital, following doctors around, seeing how things work in the hospital. Then I realized I actually want to do that as part of my career, so hence I chose medicine.
So I think it's very important to actually get the exposure. Yeah, is that right? Because I think most of those who actually started to actually be having interest in this field is from the exposure they'll get during the stint at the attachment at the hospital. Some may not be very long. I think Christine, how long was yours
It's
back
only
then?
about a week plus. It wasn't very long, yeah.
Yeah, but I think that exposure is actually the most important thing that sets yourself, to have a passion on this particular field and then move on from it. Shinji, how long was yours?
Mine was only 2 days. It's kind of like just a weekend.
Yeah, that was already enough.
Yeah, it was enough. Yeah.
Yeah, that's good. That's great to hear that. All right. So talk us through about the application process. Because I know that when you apply for medicine, you have to apply like very early, correct? And then of course, there's also the entrance test, there's a personal statement, and of course, you need to actually have the language test, right? And of course, it's an interview as well. Talk us through about that whole entire process, maybe just briefly.
Actually, the process starts very early on, about more than a year before you actually enter your first year in university. So it differs depending on which country you want to go, because the intake time is actually different. So in the UK, the first year usually starts around end of September to October. So the application process actually starts more like closer to like more than a year before, so about June, July. And there's quite a few things you need to do for the application. So there's firstly through the UCAS platform, where you choose 5 different universities where you want to go within the country. And then after submitting application on the UCAS, we still need to do admission tests, which is different for different uni as well. There's the BMAT for Oxford, Cambridge, and Imperial, and then there's a UK CAT that's more applicable to other UK universities. So apart from the admission test, there's also the personal statement, which you need to write, and also and interviews with different medical school that you apply to. Yeah.
So those are the basic things. Yeah. What about Shin Jee? How was the application for University of Auckland?
So for mine, our admission is usually around February. So I think I did my application about 10 months before February, so it would be about April. So all I did was I rocked up to the placement center and I got an application form, filled that up, and then got called for an English test. That is kind of like a bit on your grammar and a bit of an essay. And then I get shortlisted for an interview. Following the interview, I passed the interview and then I got a conditional offer, which is how I got in. I think it's much simpler compared to the UK system, given that there's no like aptitude test, the BMAT or the UK CAT. But some other Australian universities do have those tests that they will hold as part of the admission requirements.
Christine, as I remember correctly, Christine, the UK CAT and also the BMAT entrance exam that you have to take, it was quite demanding, right? There was a lot of questions, and there's also there's a time limit to it as well, right?
Exactly. So the UK CAT, I didn't take the UK CAT, but most universities require it, and it's mainly MCQ based, and if I remember correctly, because it's almost 10 years ago, it may be a bit different now. It's almost like an IQ test. It's a logic test mostly with some time. But so for my own case, I took the BMAT, and BMAT basically has a few papers. It tests you on your science knowledge. So whatever you learn in A-level, science and math. And also there's a 30-minute one-page essay that you need to write. Yeah.
Yeah. Thanks for that explanation over there. So you went through the application process. So what our students can actually do, in order to make their application stand out? Definitely a few things that you can actually do, like for example, what kind of extracurricular activities you need to include, like what kind of competitions you can actually include there in your CV or your personal statement. Like is there charity work required? Is there a need for you to include attachments, that you have actually went through, like maybe a life story as well, I don't know. What else can you actually do to make your personal statement stand out from thousands of applicants who sends in application, for the course?
So basically your personal statement is telling the university why they should choose you instead of other people. It's just like any other job application. If you apply for the job, the company will sure ask you, why not another candidate? So a few points that you can put in your personal statement is firstly, I guess the main thing is the reason why you want to do medicine. So some people has like a story or actually like real life story about what happened to them that caused them to actually veer towards this route of medicine. But for me personally, I don't have a story. So I just explain that I really like the science behind. I like the biology, the chemistry, the physics. Therefore, I think medicine is a good choice for me. So that's the first part, your reason. Definitely don't make up story if you don't have, just to gain some sympathy from the university, because they will ask you about it during the interview itself. And you don't want to be caught lying just from your personal statement alone. And otherwise, apart from your reason behind, you should include what you basically what you have done academically to show that you're interested in medicine. For example, choosing the right subjects like biology, chemistry, physics, and maths, and actually doing well in them. And next thing is you can, apart from the academics, you can talk about what are the activities, extracurricular activities that you have done so far to show that you will be a good medical student and a good doctor. For example, in my case, I included that I was part of the Taylor's Model United Nations, which showed that I was there to call my public speaking skill and my leadership skill. And other small parts that you can include are, for example, what are the interesting hobbies or interesting things that you do in life. So to show that you're not actually a very boring person, you're actually quite holistic. But of course, don't just include a lone sentence without any like examples. Always tie whatever you're saying back to why this is relevant to medicine and why you'll be a good doctor. That's your personal statement.
I like the part, Christine, about the story. Normally I will see students to try to their level best to put in a story, a medical story, into their personal statement. Very important. Yeah, remember not to fake it. Right, not to actually fake it. Please just write something that is actually genuine, something that really impacted you, on why it actually spurs you to actually apply for the course. Good, because right, like what Christine mentioned just now. Shin Jee, what about yourself?
So for myself, the New Zealand application process does not require a personal statement, but I also wrote a personal statement for the UCAS system. But throughout medical school, going through it, I realized that medical schools, they usually would really want to see their candidates have a life outside of medicine, because medicine, like medicine itself is not all you're going to do. And by showing that you have something outside of medicine shows that you have a kind of like a good protective factor towards, the stressors that you may encounter throughout medical school.
Yeah, good to point out, because you need to actually be doing something else outside too, right? To have a balance in life, right? Yeah, that's something very important to point out. Christine, you want to add something?
Yeah, if you really have no idea where to start, you can look online, because there are a lot of personal statements online of examples. And after viewing a few, you get a brief idea of actually what this is about and what to write. If after writing, it's definitely a good idea to get a senior, whether your teacher or someone who's already in medical school recently, to read through it. Make sure that it's relevant and there's actually no grammatical mistake. That's a basic requirement, that your personal statement is actually of good English. Yeah, there's a lot of service online that says they can read personal statements or even write personal statements for you. I wouldn't recommend going through them if possible, because firstly it costs, secondly it's not truly yourself. So try to come up with something of your own. Yeah.
I remember, Christine, you were such a pro back then. All your classmates was basically giving you their personal statement for you to read through.
Well, it's kind of because medicine is always the first one who applies. So I'm the first one who wrote it and went through the process. So when other courses like engineering students are applying through the UCAS, I kind of just help them through it. Yeah.
Yeah, so nice of you. All right. So, talk us through about the interview process. Was it grueling? You know, a lot of students saying that the interview was always the toughest part of it, and most of them come out not feeling very confident, very happy about it. How was the interview session for both of you? You know, was it difficult? You know, what do they actually want from the interview? Actually, a lot of students were not too sure. You know, what they are actually going in for. A bit. So they are a bit not very confident with it. So Christine.
So, so I think I haven't mentioned at this point that actually I went to Cambridge for my medical school, and I applied to 4 other universities. And the one I remember the most is the Cambridge one, of course. And each university's interview is very, very different, regardless of what country or what school you are going to. And some of them need you to pay a small amount of money to do the interview. So when I went to the interview, what they are looking for is not so much about a house, not so much. Let's focus on your background per se. They'll probably start off with a simple question of why you want to do medicine, what's the reason behind. But of course, they've already seen your personal statement. Actually, the major chunk of the interview itself is like a tutorial. So in my case, the interviewer basically gave me a question on a placenta, like how does placenta thickness, blood flow, for example, affect the nutrition of the baby. At that point, what would I didn't know anything about medicine. I actually have no idea what he's talking about. But I can use I was trying to answer the question based on first principles, based on what I learned in, for example, chemistry and biology, and try to answer the best I can. So instead of just giving like one answer, I tell him my thinking behind, I show my working. And most of them actually, when he saw it, even though most of my answers are actually wrong, he heard what I said and actually said that, oh, actually my thinking behind is logical, it makes sense. It can work that way, but it's just that in nature, it didn't go out that way. That's why in medicine it's a different story. So yeah, even though I didn't manage to answer most of the questions during my interview, it actually, surprisingly, I got in. Yeah.
So I guess the most important thing is that they're not looking for a correct or wrong answer during the interview, right? They were basically wanting to know how you can represent yourself, during the whole entire process, how you think, like what you mentioned just now, the logical thinking process. They want you to really see whether you're the type of person who is actually suitable for the course or not. So yeah, that's basically what they were looking for, right? Shin Jee, how was your experience for the interview?
I think it's pretty similar, starting off with why you want to do medicine. That's like a question that they almost always have in an interview. And then it comes with like a situational judgment, ethical like questions, which has no right or wrong. But all they wanted to know is that you have a logical thinking and you have like good justification to your answers. The other thing that they would really look for, it's kind of like your behavior. I would say they prefer someone who's like humble and confident, not too arrogant, because most of these interviewers are either lecturers or actual working doctors who has got background in like clinical education. So you will be their future colleagues. So they will choose people who they think are nice to work with for the interview.
So you have heard it, right?
My interviewer was actually my lecturer. So in school, I still see him even after the day during my interview. Yeah.
Yeah. So don't be arrogant during the interview. Yeah. Be nice. Yeah. Yeah. So yeah, that was the interview process. So talk us through about the whole duration of your studies. There were 6 years, I guess, for both of you, right? 6 years of studies.
Yeah, it's 6 years, and some uni has like 5 years, some uni 6 years. It depends on what type of uni you go to. Some unis are like traditional courses, for example, Oxford, Cambridge, which which by traditional, I mean, like, for example, you learn your basic sciences before you are released into the hospital to see patients. You do like your anatomy, physiology, pharmacology in lectures, just like in A levels for the first 3 years. And then in your final 3 years, only you're put into the hospital and you actually talk to real patients and learn the diseases for real. Yeah. There are other unis in the UK that are not traditional. Most unis in the UK are not traditional approach. Some of them have system-based approach, some of them problem-based approach, which some may have very early patient interaction. Like for example, their first day in medical school, they're already put into the hospital and start talking to patient. So it depends on what type of course suits you. So then you can choose the one that you like.
Shin Jee, how was your study?
So mine's somewhat similar to Christine's, in which the first part of medical school, the first 3 years, we go through what we call the preclinical years. So it's similar to what A-level lectures are like. You just sit in a class and like learn, attend labs, occasionally dissection labs. For us, we go through different modules, different system modules. So you go through like the musculoskeletal system, the cardiac system, the respiratory system, and more. Apart from that, we also have like teachings for clinical skills and professionalism, ethics kind of thing. Second half of the course would be the clinical years, where you go into different hospitals, going through different departments, kind of like learning on the floor, learning as opportunity arise. And the very last year of medical school, it's what we call a trainee intern year, in which you kind of learn how to become a house officer, which is what you are after graduating. So you kind of like shadowing the house officers, doing what they actually do. So would involve a lot more practical stuff than just the clinical or preclinical like studies.
Yeah. Right. Were you guys left on your own during your clinical years? You know, I mean, how's the learning process is actually going to be like during the clinical years?
Yeah, so I think actually it's not just clinical years, it's throughout your medical school. You need to be quite independent, you need to be very proactive on your learning. You can't expect, like, for example, still in like Form 5 or maybe A levels, that your teacher just spoon feed you everything, you just learn from the lecture notes. You need to be very proactive and start looking out for things to learn on your own. For example, during the clinical years, basically I treat the hospital as, for example, my lab is where I go and look for things to learn, look for patients to talk to. There's no one who will take your attendance. You can just go in anytime you like, leave anytime you like, and just decide your own schedule. No one will say anything. You can spend the whole, you can choose not to go into the hospital if you want. But I don't think without seeing real patients, you will become a good doctor. So for me, what I usually do is during my clinical years is I'll go in, I'll follow the team, the other doctors for their ward rounds, and they don't expect medical students to contribute much, but it's a good place to learn from them about what cases there are in the hospital, and maybe there are some interesting cases, and then I can go and see. Because the patients in the hospitals are different all the time. Your learning is very opportunistic. What you read in a textbook may not be there at that time when you're there. So you learn as much as you can from what's available on the ground. Yeah.
Shin Jee, anything to add on?
So I think if I were to walk you through like a day in like a preclinical, like in one of my preclinical years, it would just be like waking up, attending lectures, and then you're free after lectures, and then you do whatever you want. A lot of whatever you want means revising. And a normal clinical day, it's kind of like, it really depends on what you want to do. Like what Christine said, no one takes your attendance. occasionally some departments do have like a little logbook to make sure that you achieve what they want you to achieve. For example, in like obstetrics, they expect you to see like a number of births. So you got to be in like the labor suite waiting for births, that sort of things. But apart from that, the rest is generally like really depends on yourself. So I think a good candidate in medical school would require like a lot of initiative, because if you don't go there, you can sit at home and learn from textbook, still pass the exam. But after medical school, when you come out to like the actual clinical world, then you realize how much you're lacking behind from not gaining those experience during medical school.
All right, so really need to actually be proactive in order to maximize the clinical years that you are actually exposed to, right? Definitely need to be proactive. Right, so what about after graduation? Do you all need to like apply for license, or do you all go straight into housemanship? So maybe Shin Jee want to start first here, right now.
So after I passed medical school, I guess before, like to pass medical school, you have to pass their exams. So the exam comes in different formats. Some is written, some is what we call observed structured clinical exam, so OSCE in short, meaning one of your like a few of your senior colleagues would be watching you examine patients. You would tell them kind of like your train of thought, how would you arrive at that diagnosis and that management plan sort of things. And there are like multiple stations of those, so you have to go through them. And that is pretty stressful, but would be doable if you practice enough and like have enough exposure. And then after you pass medical school, I guess essentially you would think exams would end there, but obviously not. Christine is going through a lot of exams in specializing. But certification wise, if the country that you're intending to work in, well, if the medical school is recognized in the country that you are intending to work in, I don't think there's any specific like certification process that you have to go through.
Yeah, so I'll briefly talk about the certification part first, because, but well, for example, if you intend after your school, you intend to like work in Singapore, for example, not all medical school in Malaysia are actually recognized here. There's only a specific number of schools that in this thing called a second schedule in Singapore that is actually recognized. So if your school is not recognized in the country that you intend to work in, and that will be quite a pity. So I'll say do your research before you apply to the university that you want to go to. And okay, so now I'm going to talk about the exams. So of course, there's yearly exams in medical schools that sometimes can be quite demanding. So in preclinical years, there are MCQs and there are essays. There are still essays that you need to write. So don't throw away your writing skills just because you think you're going to be a doctor. Yeah. And then when it comes to the clinical year, there's the OSCE, which apart from doing physical examinations on acting patients and taking history from acting patients, there's always the communication skills stations in the exams as well. Because communication skills are actually extremely important as a doctor. Not many people are actually born with a professional level communication skills. If you have, then of course you're talented and that's great. But I definitely do not have that skills. So in school, I learned how to, in my communication skills sessions, I learned, for example, how to break bad news, how to tell someone that been diagnosed with a cancer in a professional manner. So, and all these skills actually you need to bring along. So until after your graduations. So when you actually graduate and do your final exam in school, it doesn't mean like, oh, that's it, you don't need to study anymore. Actually, that's just the beginning of your medical journey. That's just a tip of it. After you graduate, there are lots and lots of exams that are coming your way depending on what you want to do. So if you choose to be in like medicine only, like medical line, then you have the MRCPs, and MRCP itself has many parts to it that you need to keep doing. And if you choose to be a surgeon, that's the MRCS exam. Or you choose to be an anesthetist. For example, for me, I'm going to take exams soon, and there are multiple parts of it, and you have to do this one exam every few years until you finish your specialization and your consultant. Basically, you just have to keep studying and keep taking exams if you choose to do medicine. Yeah.
Lifelong learning. Lifelong learning, right? Yeah. So, okay, right. So housemanship like, yeah? Because I think a lot of students wanted to know how's life like, when you're a houseman.
So I think once you finish the 6 years of medical school, although it may sound long, you come out thinking that you would know everything. You're ready to change the world, save lives. Then you start working as a house officer, and then you realize the truth is you're actually just a glorified clerk. So there are a lot of like petty little things that is a house officer's job. Some practical skills like putting in an IB lure that requires like no real thinking would come under the house officer's scope of jobs. But otherwise, it's kind of like the hours, which is pretty doable for me. I can't say for Christine and the rest of, well, Malaysia and Singapore. But otherwise, it's a lot of realization that you actually don't learn enough in medical school, and there's way more to learn, which I have accepted, like everyone would have, as you step into house officers year. It's kind of like a beginning of a whole new journey that you are about to go through. Thinking about which route to specialize, what do you have to do to prepare for specialization, and alongside with that, working long hours would be pretty tough, and it's not for everyone, I would say.
So yeah, it really depends on the country that you work in, whether they subscribe to the European working hours, which is about 48 hours a week. So if you're working in Malaysia or Singapore, or most Asian countries, which we don't observe this limit in working hours. When I was a houseman, I can work up to or more than 100 hours a week. It's actually quite crazy. And you think like, how is that even possible? Because, for example, I start work at like 6 something and I can end at night, like 8 or 9. And if you're on call, a call system here actually, one call lasts 30 hours. And sometimes if you can't finish your work after the 30 hours, you need to continue working. And the longest I did was about 34, 35 hours. It's actually non-stop. You just have to keep working for that duration.
Wow. Can you still walk back home or not after that, 35 hours working straight?
So I thought I thought at first when I first started doing it, it was really quite tiring. And when you come home, you just collapse on the floor. You sleep on the floor. I didn't even bother changing out or going to shower anymore. I basically opened the door and lie on the floor and fall asleep. So that was the start of it. And I didn't even know it's possible for someone to actually work for 30 hours until I actually go through it. But as the year goes by, your body kind of get used to it. So for now, I'm actually quite all right with it. Like after the end of my course, I can still actually go and have breakfast and go and have meal. Yeah.
How long was your housemanship, Christine?
Yeah, so housemanship in Singapore is about a year only. And there's 3 different rotations. It's either medicine, surgery, orthopedics, ONG, or PEDS. just pick three and go around different hospitals in Singapore. I know that in UK and Malaysia, it's actually 2 years long. It's longer, and yeah, I'm glad it's only 1 year here. Yeah.
I'll do another session, right? Speaking about HO in Malaysia and how to actually have the progression after that. So, but let's talk about in Auckland. What about Auckland, Shin Jee? How many years of
2
housemanship?
years of house officer years. So we do 4 rotations each year, so 8 in total.
Okay, all right. And then after HO is just the beginning of everything, like what you mentioned just now, right?
Yeah. So once you graduate, you become a house officer, and then it depends on whether or not you know what you want to do. So if you're still quite unsure, by the end of the second year, you may do like a 3rd year of house officer, which is something that people still do here. Otherwise, we would proceed to becoming a medical officer, which is what we call a registrar here. Slightly different term, but it means the same.
Yeah, the I'll say HO is just the beginning of it. You do more like paperwork, like signing the NCs, doing the discharge summaries, and doing more physically demanding work, like running around, taking bloods and setting IV cannulas. And it's physically demanding, but you don't have as much responsibilities. And at the end of the HO year, actually life to get better. HO year is one of the worst years of my life, but I'm glad that it's over. And you do see the light at the end of the tunnel. And as a MO, you have less physically demanding job depending on what you do. Like surgical MOs are actually you need more energy to do the surgery. But if a medical MO, actually you take on more responsibilities in making decisions, doing the judgment calls on how to manage a patient overall as compared to an HO. Yeah.
So, Christine, you're on the pathway to specialization, right? How long roughly that will take? I think it depends on the
Yeah,
workload.
it depends on the specialty. I'll say a minimum of 6 years if you're fast. And if you're decided at the moment that you become a doctor and you decide to specialize, if you're fast and then you get accepted by whatever training program that you intend to get into, minimum of 6 years. And some may even go up to 10 years, depending on country and specialty. Yeah.
There's going to be a lot of exams coming.
Yeah. And you take an exam every, say, 2-3 years. Yeah, the exam can be a written one, can be an OSCE one. It just keeps going more and more, and it's actually more difficult than medical school. Because the difficulty of the exam itself is actually more, but also because while taking exam, you need to work as well. Unlike in medical school, you're a student, you just study and take exam. You don't actually have to work. Yeah. So actually it gets a bit tougher. But I say it's doable. Yeah.
Okay, so those are the progression, right, after HO years, right? So okay, there are some questions from my students. I'm just gonna ask them now. Yeah, right. Okay, Christine, question is directed to you. You graduated from University of Cambridge, right? So a lot of my students are actually wondering, is it how's life, studying there, in University of Cambridge? Is it depressing compared to like other unis? Why would you actually choose University of Cambridge?
So I think that's what most people would think. How studying in a top university is like very stressful, very demanding, and all that. But actually, it's 6 best years of my life. I would say I'll give anything to go back to those 6 years. It's actually very fun. Apart from going to the lectures and learning new things every day, I also get to do a lot of things. For example, learning how to be an independent person overall. Like I learned how to cook, how to bake, how to go and travel, and I also make a lot of friends on the way. of course, the start of the medical school is difficult. You need to adapt to the new environment, the new country, the new accent. It's as though it's a different language, and you're trying to learn medicine, and you're trying to learn how to cook, learn how to buy groceries. But it was really, really very fun. Yeah.
I remember you had a little bicycle that you actually used to travel around campus.
Yeah, so Cambridge is not a campus university, it's a university town. So things are littered all over a town, like lecture halls here, an anatomy lab in the place. So in order to go from one place to the other, we walking basically takes too much time, and we used to just cycle and zoom around. We call it is like being in a Harry Potter movie where it's your broom and you just zoom all over the places. Yeah.
All right. Sounds fun. Shin Jee, how was your 6 years?
Oh, my 6 years are really enjoyable. Would totally do anything to go back for to those years where it's like responsibility free and carefree. As daunting as med school may sound, it's actually very doable as long as you put in the good amount of effort. If you're passionate in it, it is actually not that difficult, and you can actually like enjoy life outside of medicine. Yeah, it was a fun time.
Yeah, I remember you visiting different plantations also, right?
Yeah, that's right.
Yeah. All right. So this is another question from one of my student. Yeah. So this students wants to know which are the recommended schools or university to study, abroad or locally, and what is roughly the academic fees yearly. I feel like this question is like it changes every year, right? Because the ranking, the
Yeah.
university ranking changes every year. So it really depends, right? On where you want to actually go for. But I think there's a certain thing that you have to look out for in deciding which uni that you're going to take your medical degree. Shin Jee, what's your advice? What's
I would
think?
say if you're wanting to be in the top ranking universities, then obviously look for the ranking list. But otherwise, like what Christine has mentioned, the different types of teaching the universities offer. So some is like the traditional one, some is problem-based learning, system-based learning. I guess get a feel of like what type of learner you are and what do you think would suit you best, and go for those universities. The other thing that should be considered is your future prospects, like where do you want to work? Does the country that you want to work recognizes the medical school that you are going to attend? That would be two important things that I think one should factor in. Cost-wise, it changes every year. It goes up every year, almost never down. That one varies between universities, so it would be best if you go straight to like the university homepage to check out the fees. They will usually publish it. They're not kept a secret, but bear in mind they always go up every year.
Yeah. Christine, anything to add on your side?
Yeah. So I'll say definitely do the research. Like I mentioned earlier, so like don't go to a university that's not recognized. That's the most important thing. You think that how can it be medical schools that are actually not recognized by anywhere? But yes, there is. So definitely do your research on that part first. And of course about the fees. This is actually quite an important factor to consider when you're choosing which medical school and what country you're going. So, like for example, in UK, when I started in the first year, it was like £35,000 per year. And when I finished my 6 years, that fee has doubled. And I'm quite sure it's still going up now. So if you factor in the living expenses, it's definitely more than £1 million. So yeah, you definitely need a financial support. And of course, if you manage to secure a scholarship for it, then that will be amazing.
And I believe it's kind of difficult to get scholarship for medical science, right?
it's difficult, but there are some that are lying around. Just have to dig around. I mean, it's a huge pot of money. If you manage to dig it out, I'm quite sure it's worth it. Yeah.
Okay, this is another question. Yeah. Okay, so let's say after the student finish medical school and during the clinical years, this particular student doesn't feel like want to work to see patients. Doesn't want to do anything related to medical science anymore. What else this student can actually do? Is it life destined to just be a doctor seeing patient every day?
So I guess traditionally, like finishing medical school, becoming doctor, seeing patients is what one can do, what people would think it's the only option. But there are actually plenty of options if you finish medical school. I'm not quite sure if you quit halfway, what sort of things you can do. But if you finish medical school, specialization itself has got a huge variety, essentially. You can choose not to see patients by becoming a pathologist, looking at slides, diagnosing what sort of specimen that comes to you, what sort of problem that is, kind of thing. Or you can either be like a radiologist, looking at X-rays, CTs, MRIs, and not having any interaction with patients. That is one. Still a doctor, but you just don't quite have good enough patient interaction. And then if you are really enjoying like patient interaction, you can be like a GP, sees a lot of patients in clinic, form a good relationship with them, sort of thing. The rest would, I think, is kind of like in between. You can be you can work in a hospital as a hospital medicine or like clinical medicine. If you are not looking at becoming a doctor, other options are like clinical research. You can also do like clinical education, becoming a lecturer, or nowadays with COVID, you can also contribute to like, the COVID defense and be part of like the ministry kind of thing.
Yeah, there are a lot of options of what you want to do. Like actually during the medical schools, during my preclinical years, I was even given an option to like explore what other courses I may be interested in. So during my time, I actually went in a year into a pathology and genetic engineering and basically do like actual bench work, like pipetting and all those. And at the end of my third year, I actually got a Bachelor of Arts, which is a Bachelor of Science equivalent. It's just my uni being a bit eccentric. So we got a Bachelor of Arts, and it's actually usable like in real life. And if you do decide to become a researcher at that point, you can stop being a medical student and go into the natural science route and become a researcher. So like Shin Jee said also, medicine actually itself is so wide. There are like different levels of interactions with patients, different levels of different kind of job scope basically. And you won't know what it actually entails until you actually properly experience it. So apart from like radiology, pathology, and actually anesthesia also is quite less patient interaction. There's also the hospital admin, meaning like the CEOs of the hospital. Very often they're doctors. Yeah. And if you do decide to get out of the hospital and the clinical setting entirely, there's always the pharma the pharma industry that could use us. Yeah.
All right. Thank you, Christine. Thank you, Shin Jee. Right. I think you have actually talked a lot about everything about medical studies as well as also working life about it. I think the more that you can possibly speak, but maybe not in this particular podcast session. Right. So one last question. Yeah. So who should be applying for this? To do medicine. It's going to be a huge decision, right? So who, what kind of students, what kind of attributes, what kind of personality, what kind of characteristics the students need to actually have, to survive that medical schools, and of course, to come out to work, what kind of people should be applying for this?
So I think firstly, you must have a reason. The first point is you must have a strong reason of why you want to do medicine, and you don't just come in because someone asks you to. You must have a personal reason to keep your drive, keep your motivation there all the time. And I think secondly is you should be academically quite good. You don't have to be super smart. Doctors are not all super smart people. You just have to be hardworking enough. In medicine, in medical school or as a doctor, the most important thing is actually you're hardworking and you do consistent work all the time. And being smart actually, that it gives you somewhat an advantage, but being smart itself can bring you through medicine. Because like a lot of things in medicine are like, for example, learning names. Even though you're a genius, you won't know the names or something until someone tells you that's what it's called. So yeah, you have to be hardworking.
Yeah, I would think like someone who genuinely has the passion, who's like a curious person, would suit medicine. But definitely having the passion and having the drive is really important, because this is going to be like going into medical school. It's just a start of a very, very long journey that will require a lot of sacrifice, not just from you, but your family members as well. So I guess if you're really, really sure, then I think, and you are academically okay, then you would suit medicine. But one thing that most people would have a common misconception, I guess, it's people going into medicine for the money. But I think money itself is not a good driving factor for you to survive medical school and your medical career. If you're like driven by money, you're much better off doing something else, I would say.
Sometimes I notice also students are drawn into studying medicine because family pressure. Should the student be be a good boy, good girl, study hard, get the grades, enter medical school, and then don't know what happened after that. What is your advice on this?
I mean, for myself, like I am fortunate enough to not be in that situation. I got into medical school on my own will. But I would say like temporarily pleasing your parents, followed by I guess like followed by doing something that you don't enjoy for the rest of your life is not quite really worth it. So I think really have a good think about it. Talk it through to your parents. But definitely don't do medicine if you're not interested in just because your parents say so.
Yeah, I agree. So in medicine, it's a lot of hard work. It's not just the school itself. You can imagine, like, for example, you're so tired and you keep working like 100 hours a week at 3 a.m. and you're wondering what brought you there. If it's because someone asked you to do it, for example, if your parents ask you to do it, you're going to resent them for making you work so hard. So you definitely definitely don't do it because someone else asked you to. Definitely do it because you want to do it. And another fact, and of course, this entire medical school journey and also the specializing journey would take like 10 or 20 years of the prime of your life. So if you do it because of someone else, I mean, you're missing quite a lot of good times in your life just because of someone else. And of course, there's a lot of financial implication if you go down this road. And if you do it because of someone else asks you to, I mean, and in the end, if you give up medicine and do something else, and it will be quite a lot of money that is could be put to better use, basically.
Shin Jee, Christine, can we take one question from the students right now who is actually with us? It's in the meeting chat. Are you all right to pick up this question? This student of mine is actually asking that if this student has a congenital medical condition, are they eligible to pursue medicine?
I don't think it excludes you from pursuing medicine as a career, but that's kind of like a question that's really vague, but it's quite hard to generalize because some conditions may preclude you from doing medicine. So it really depends on what condition it
It's
is.
best if you ask the university itself, right? I think they can actually give you a better answer.
Yeah, I would think so.
What do you think about this?
I think it depends. Yeah. So, for example, when you apply for universities and job as a doctor, if you have like a blood-borne disease, it's important that you let them know. It doesn't preclude you from it doesn't like exclude you directly from doing all of medicine. There's still some part of medicine that you can do. And in terms of physical, like if you have physical disability since young, it also doesn't like exclude you directly as well. I do have classmates that actually as in like needs like walking aids to go around, and it actually doesn't stop her in any way. I mean, like she obviously she takes a bit more time compared to us. We need to like run around the hospital for resuscitation, but there's definitely ways to go around it. Yeah.
I would say like if you have like some arthritis that might in your hands, then that might preclude you from doing surgery, or like I'm not quite sure if I can think of others, but if you have dyslexia, even you can be in medical school. In their exams, they would allow more time for you. That's just about it.
What about the student has a visual issue, can't see with one particular eye?
I'm not quite sure about that.
I think it's best that we ask
Yeah.
the university itself, because this is a different specific conditions that I think they have to consider, right? Upon looking
Yeah,
at the
I would
students
think.
and so on.
Yeah, I would think so, because I guess like if you lost like vision in one eye, that may have a bit of impact on your depth judgment. So not quite sure really.
All right. Okay, I think we have heard so much from you guys. Thank you for being on the podcast, right? Very nice to see both of you after like I think 10 years. Such a long time I've not seen both of you. So thank you for spending your time here, right? For our podcast. I'm sure our listeners will actually benefit a lot from our session today. So if you like what you heard and you have actually benefited from today's session, please give a thumbs up, a like to the video, subscribe if you have not. Please give comments also on the comment section, thanking both doctors over here, Dr. Christine Wong and Dr. Shin Jee Tang, for her time over here, right? So they basically share a lot of, I think, important tips, right, and advice on not just applying for the medical course, but also how's life like, as a HO and also MO right now. So if you want to hear someone from Malaysia in this particular podcast about the same field, medicine, be sure to actually comment at the bottom, yeah? So let us know, right? If you actually want to actually hear more about, how it is like working in Malaysia. But anyway, thank you again very much. Thank you very much to Dr. Christine Wong and Dr. Shin Jee Tang for your time.
You're welcome.
All right, thank you again, thank you very much. All right.